If you've ever felt a strange heaviness behind your eyes when you wake up in the morning, or noticed your heart beating a little harder than it should when you roll over in the middle of the night, your body may be trying to tell you something important, something that doesn't show up on a standard blood pressure reading. Because here's what most people managing high blood pressure never find out. The hours you spend sleeping may matter more to your heart than anything that happens while you're awake. And what you drink in the hour before bed may either support that process or quietly work against it. Today, we're going to look at 3 specific drinks, each with real clinical research behind them, that may help support healthier blood pressure during the overnight hours. We'll break down exactly why nighttime blood pressure matters so much, what happens inside your blood vessels while you sleep, and how each of these drinks may help. And drink number 1 has a head-to-head study comparing it to a common prescription blood pressure medication, with results that surprised the researchers themselves. Stay with us. This one is worth understanding fully. Here's something most people have never been told, even if they've been managing blood pressure for years. Your cardiovascular system follows a rhythm. During the day, when you're moving, talking, thinking, reacting, your blood pressure runs higher. That's expected, that's normal. But at night, something important is supposed to happen. As you drift into deeper sleep, your nervous system shifts gears. It moves away from what researchers call the sympathetic state, that alert, reactive mode, and into the parasympathetic state, rest and repair mode. When this shift happens properly, your blood pressure drops, typically somewhere between 10 and 20% lower than your daytime readings. Researchers call this nocturnal dipping, and it's not just a number on a chart. Think of your arteries like a garden hose that's been running at high pressure all day. That nightly drop is when the hose finally gets to depressurize. Your blood vessels relax, your heart rate slows, the inner walls of your arteries get a chance to recover. Your kidneys, which act like the filter at the end of that hose, can do their job more efficiently. It's one of the most important recovery windows your cardiovascular system has, and it happens every single night. But here's where it gets complicated. Research suggests that somewhere between 30 and 40% of adults with high blood pressure don't experience this dip properly. Their pressure stays elevated through the night, or in some cases, it surges even higher, reaching dangerous peaks in those early morning hours, roughly between 4 and 6 a.m. Cardiologists call this pattern non-dipping. And multiple large studies, including a 21-year longitudinal follow-up published in peer-reviewed cardiovascular research, have linked it to significantly higher rates of stroke, heart attack, and kidney damage, even in people whose daytime readings look similar to those who dip normally. Read that again. 2 people, similar daytime numbers, similar medications, but the one whose pressure doesn't drop at night carries meaningfully more cardiovascular risk over time. And most people have absolutely no idea which category they fall into, because nobody is checking blood pressure at 3 a.m. Now, is there anything you can actually do to support healthier nighttime blood pressure patterns? Research suggests the answer may be yes. And some of the most accessible options involve something you probably already do every evening: what you drink before bed. Before we look at each drink, it's worth understanding why the hour before sleep is such an important window. When your body begins its transition towards sleep, it's running through a checklist. Stress hormones like cortisol need to start declining. Your heart rate needs to begin slowing. Your blood vessel walls, which are lined with smooth muscle, need to receive the right signals to relax and widen. Certain nutrients and plant compounds, when present in your bloodstream during this window, may help support these processes. They can influence how well your vessels relax, how efficiently your kidneys manage fluid balance overnight, and how smoothly your nervous system makes that shift from reactive to restorative. That's the basis for the research on these 3 drinks. Not overnight miracles, not replacements for prescribed medication, but meaningful, measurable nutritional support, delivered at exactly the right time. Let's start with number 3. Drink number 3 is one of the most surprising entries on this list, because it's something most people already have at home and have never thought of this way. Skim or 1% milk. 1 cup, 30 to 60 minutes before bed. Now, before you click away, stay with the reasoning for a moment, because the science here is more interesting than the simplicity might suggest. Your blood vessel walls are lined with smooth muscle cells. These cells have one job. They either contract, making vessels narrower and pressure higher, or they relax, making vessels wider and pressure lower. To relax properly, those muscle cells need three specific minerals working together: calcium, magnesium, and potassium. Low-fat milk contains all three. Calcium helps blood vessel muscles function efficiently. Magnesium helps those muscles let go. It's essentially the off switch for vascular tension. And potassium helps your kidneys excrete excess sodium, which is one of the primary drivers of elevated blood pressure. When these three minerals are available together at the right time, your blood vessels are better equipped to do what they're supposed to do overnight. The research supporting this is real. Multiple prospective studies and meta-analyses, including a large cohort study published in the American Journal of Hypertension and a dose-response meta-analysis of over 57,000 participants across 9 studies, have found that regular low-fat dairy consumption is associated with a meaningfully lower risk of developing hypertension compared to those who don't consume it. One important detail, and this is where most people get it wrong: it needs to be low-fat or skim milk specifically. The research consistently shows this association with low-fat dairy, not whole milk. Why? Because the saturated fat in whole milk may promote arterial stiffness, which works against what the minerals are trying to accomplish. You can't have one negating the other. 1 cup of skim or 1% milk about an hour before bed. Simple, inexpensive, and backed by consistent long-term data. If dairy doesn't work for you, lactose intolerance, personal preference, whatever the reason, that's completely fine. The next two options are even more strongly supported by clinical evidence. And drink number 2 works on something that most people managing blood pressure completely overlook. Drink number 2 is chamomile tea. And if you associate chamomile with being nothing more than a gentle sleep aid, the research suggests it's doing something far more interesting than that. Let's start with the sleep connection, because this matters more for blood pressure than most people realize. Think of your stress hormones like an alarm clock that never fully turns off. When sleep is poor, when you wake up repeatedly, lie awake for long stretches, or never reach the deeper stages of rest, your body continues producing elevated levels of cortisol and adrenaline overnight. These hormones have a direct effect on your blood vessels. They keep them in a state of contraction. They interfere with the parasympathetic shift that's supposed to bring your pressure down, and they create a loop that can be surprisingly hard to break. Elevated pressure disrupts sleep. Poor sleep keeps hormones elevated. Elevated hormones keep pressure up, night after night. Chamomile works on this loop. It contains a compound called apigenin, a flavonoid that binds to specific receptors in the brain associated with calm and relaxation. Research, including a well-cited study published in the Journal of Advanced Nursing, has shown that regular chamomile consumption is associated with improved sleep quality, faster sleep onset, and fewer nighttime awakenings. It's not sedating the way a sleep medication is. It's more like a gentle biological signal that it's safe to wind down. But here's what most people don't know about chamomile. It also has direct cardiovascular effects, independent of sleep. Lab and clinical research, including a 2025 study published in a peer-reviewed pharmacology journal, has found that chamomile extract exhibits meaningful vasorelaxant effects. It appears to work through calcium channel modulation in blood vessel walls, helping smooth muscle cells release tension. Additionally, chamomile's flavonoids have been linked to reduced markers of vascular inflammation, which matters because chronic low-grade inflammation contributes to the arterial stiffening that drives elevated blood pressure over time. A clinical trial noted in cardiovascular nutrition literature found that participants who consumed chamomile tea twice daily for 8 weeks experienced measurable reductions in both systolic and diastolic blood pressure. The effects were mild to moderate, not dramatic, but consistent and without side effects. So chamomile is working on 2 fronts simultaneously: improving sleep, which reduces the stress hormones that keep pressure elevated overnight, and directly supporting blood vessel relaxation and reducing vascular inflammation. How to use it effectively? Use 2 tea bags per cup, or 1 heaping tablespoon of loose-leaf chamomile. Steep in water just below boiling, around 200 degrees, for a minimum of 5 to 7 minutes. Not 2 minutes, not 3. The longer steep draws out a significantly higher concentration of apigenin and other beneficial compounds. Drink it 30 to 45 minutes before you intend to sleep. That timing allows the compounds to be active in your system during the most critical part of the overnight window. Quality matters more than most people assume. Look for organic chamomile where the flower is the primary ingredient, not a tea with chamomile listed fourth or fifth after other fillers, and consistency matters far more than any single cup. Research shows meaningful effects after 2 to 3 weeks of daily use, not after one night. One practical note: if you're on any medications, including blood pressure medications, it's worth mentioning chamomile use to your healthcare provider. It's well tolerated for most people, but keeping your provider informed is always the right call, especially if your readings start to shift. Now, drink number 1. This is the one with clinical trial data that genuinely caught researchers off guard. And when you understand what it's actually doing inside your blood vessels, you'll understand why. Drink number 1 is hibiscus tea. Not black tea, not green tea. Tea brewed specifically from the dried calices of the Hibiscus sabdurifa plant, the same plant whose deep crimson flowers you've probably seen in herbal tea blends. The research behind hibiscus and blood pressure is some of the more robust evidence we have for any dietary intervention in this space, and the mechanism is genuinely fascinating. Hibiscus contains a powerful class of plant pigments called anthocyanins, the same compounds responsible for the deep red and blue colors in blueberries, cherries, and beets. In the cardiovascular system, these anthocyanins appear to act through several distinct pathways simultaneously. Pathway 1, natural ACE inhibition. ACE stands for angiotensin-converting enzyme. It's a protein in your body that triggers the production of a hormone called angiotensin II. That hormone's job is to constrict blood vessels. It literally squeezes them narrower. When ACE is inhibited, less angiotensin II is produced, and your blood vessels can stay more relaxed. Here's what makes this remarkable. ACE inhibition is the same mechanism targeted by one of the most commonly prescribed classes of blood pressure medications. Hibiscus appears to work through the same biological pathway, gently, without the full pharmacological force of a drug, but measurably. Pathway 2, endothelial support. Your endothelium is the ultra-thin lining on the inside of every blood vessel in your body. When it's healthy, it produces something called nitric oxide, a molecule that signals vessel walls to relax and widen. When it's damaged by years of elevated pressure, chronic inflammation, or poor metabolic health, nitric oxide production drops. Vessels stiffen. Research suggests hibiscus anthocyanins may help support endothelial health and restore nitric oxide signaling, helping vessels do what they're designed to do. Pathway 3, gentle diuretic effect. Hibiscus also supports the kidneys in excreting excess sodium and fluid, reducing overall blood volume and, therefore, reducing pressure. Same principle as diuretic medications, again in a more modest, natural form. Now, the clinical data. A randomized controlled study published in the Journal of Human Hypertension followed 65 adults with pre-hypertension or mild hypertension over 6 weeks. The hibiscus group saw an average reduction in systolic blood pressure of 7.2 millimeters of mercury. To put that in context, some blood pressure medications produce reductions in the 5 to 10 mmHg range. That's clinically significant territory. A 2022 systematic review and meta-analysis published in Nutrition Reviews, analyzing data from 26 randomized controlled trials involving nearly 1,800 participants, confirmed that hibiscus dose-dependently reduced both systolic and diastolic blood pressure compared to placebo across multiple populations and study designs. The consistency of effect across that many independent trials is what gives this data real scientific weight. A separate meta-analysis found an average systolic reduction of 7.1 mmHg and diastolic reduction of 3.3 mmHg, again across different populations and study designs. And one comparative study put hibiscus tea directly against a common prescription blood pressure medication. The hibiscus produced results that were meaningfully close to the medication. Not identical, but close enough that researchers noted it as significant. Why is drinking it before bed specifically important? Blood pressure naturally surges in those early morning hours we mentioned, the 4 to 6 a.m. window when cardiovascular stress peaks. When you drink hibiscus tea roughly an hour before sleep, the anthocyanins are being absorbed and reaching their peak concentration in your bloodstream during those overnight and early morning hours, providing support exactly when your cardiovascular system needs it most. How to use it effectively. And the specifics matter here. You need the equivalent of at least 1.5 to 2 grams of dried hibiscus per serving. In practical terms, that means 2 tea bags or 1 heaping tablespoon of loose leaf hibiscus per cup. Steep in freshly boiled water for 6 to 8 minutes minimum. This is not a tea you rush. The extended steep time is what draws the anthocyanins out in meaningful concentrations. Rushing this step meaningfully reduces the beneficial compounds. For best results based on the clinical literature, drink 1 cup in the late afternoon or early evening and 1 cup about 45 to 60 minutes before bed. The studies showing the strongest blood pressure effects typically used multiple daily servings. You can drink it hot or cooled over ice. That doesn't affect the compounds. The flavor is naturally tart, somewhat similar to cranberry. If that's not to your taste, a small amount of stevia or a squeeze of lemon is fine. Avoid adding sugar or honey regularly, as blood sugar fluctuations have their own downstream effects on vascular health. A few important things to know before you start. Because hibiscus works through some of the same pathways as ACE inhibitor and diuretic medications, people already taking those medications should monitor their blood pressure more carefully when adding hibiscus, and should let their healthcare provider know. The concern isn't danger. It's that hibiscus may enhance those medications' effects enough that a dosage conversation with your doctor becomes appropriate. Some people notice mildly increased urination in the first week or two as their body adjusts. This typically settles. If you manage blood sugar with medication, it's worth knowing that some studies have found mild glucose-lowering effects with hibiscus, worth monitoring and mentioning to your provider. And if you're pregnant or trying to conceive, hibiscus is generally recommended to avoid based on some preclinical study findings. As with everything in this video, please talk with your healthcare provider before making significant changes, especially if you're currently on blood pressure medication. These drinks are meant to complement good medical care, not replace it. Everyone's body responds differently, and your provider needs to know what you're doing so they can support you properly. So, where does this leave you practically? 3 drinks, 3 different mechanisms, each working on a different part of the overnight blood pressure picture. Low-fat milk provides the mineral trio, calcium, magnesium, and potassium, that blood vessel walls need to relax during sleep. 1 cup of skim or 1% milk, 30 to 60 minutes before bed. Chamomile tea works on 2 fronts, supporting sleep quality to reduce stress hormone output overnight, while also directly supporting blood vessel relaxation and reducing vascular inflammation. 2 tea bags, steeped 5 to 7 minutes, 30 to 45 minutes before sleep. Hibiscus tea carries the strongest clinical evidence, acting through ACE inhibition, endothelial support, and mild diuretic effects. 2 tea bags or 1 tablespoon loose leaf, steeped 6 to 8 minutes. Ideally, once in the early evening and once about an hour before bed. Can you use more than one? Yes, strategically. A common and sensible pattern is hibiscus tea in the early evening and chamomile tea closer to sleep. That timing makes sense. Hibiscus for its cardiovascular effects earlier in the evening, chamomile to support the wind-down process as bedtime approaches. What the research doesn't support is loading all 3 into the final hour before bed. Too much fluid, too close to sleep means disrupted rest, which works directly against the goal. And something worth being genuinely honest about, none of these drinks work in isolation. The clinical trials behind each of them were conducted alongside basic healthy lifestyle foundations: managing sodium, staying reasonably active, getting adequate sleep, managing stress, and, where appropriate, working with prescribed medical treatment. These drinks work best as part of a consistent, intentional evening routine, not as a shortcut past the habits that actually matter. Think of them as meaningful additions to a foundation that's already pointed in the right direction. If your blood pressure remains elevated despite lifestyle efforts, keep your healthcare provider closely in the loop. 24-hour ambulatory blood pressure monitoring, the kind that tracks readings overnight, is worth asking about if you suspect your nighttime numbers may not be following the healthy pattern. If you've been watching this and thinking, I understand what I should be doing. I just need something more structured to actually follow through. That's exactly the problem we built the 30-day blood pressure reset foundation to solve. It's a beginner-friendly, day-by-day program built around the habits that research consistently connects to better blood pressure outcomes. A DASH-style meal framework. No complicated recipes, no extreme restrictions. A walking program that starts wherever you are right now. Simple resistance exercises, wall sits, planks, beginner-friendly strength work that have been studied for their effects on arterial flexibility and blood pressure. And daily structure that removes the guesswork about what to do next. It's not about perfection over 30 days. It's about giving your body enough time and the right, consistent inputs to actually respond. There's a link in the description if you'd like to take a look. No pressure. But if you're ready to stop reading about what to do and start doing it in a clear, organized, realistic way, it's there when you want it. Your heart has been beating for you since before you were born. Every night while you sleep, it's still working. Still sending blood to every corner of your body, still trying to maintain the balance it needs to keep going. 1 cup of hibiscus tea this evening is a real start. Steeping chamomile for 7 full minutes instead of 2 is a real start. Swapping whatever you normally drink before bed for something that may actually support your blood vessels overnight. That's a real start. Your heart responds to what you do consistently, not perfectly. If this video gave you something genuinely useful, subscribing helps us keep making content like this. Practical, research-backed, and focused on what you can actually do. And if something in this video resonated with your experience, or if you have a question, leave it in the comments. Take care of your heart, one evening at a time.